Hi, Doug. My name is Mary, and I'm a specialist here at the Quit Line.
Good.
Good. So how can I help you today, Doug?
I've been smoking about a pack and a half, 2 packs a day for 41 years. And I recently had a bout of pneumonia, and I couldn't smoke. I'm finding myself a couple cigarettes last week, and now it's up to like 4 or 5 a day. I don't want to go back to these damn things.
So it sounds like really your health has been affected by smoking, and you really want to quit.
I have to quit.
You have to quit.
And it's at that breaking point, that craving, that you get that taste in your mouth again.
I hear that you really don't want to go back, and yet at the same time you can't just quite stop, can ya?
I love those cigarettes. Nobody liked them better than me.
What is it that you love about smoking, do you think?
The smoke going into your lungs, the feeling.
As an ex-smoker, I can remember saying the exact words that you just said. I love smoking. I love the feel of it in my lungs. I don't want to give it up. And yet, once I was able to really give it up, I realized I didn't love smoking. I did it because I was addicted to it. And that when I tried to not do it, I felt so uncomfortable that I just kept smoking. But it's good to know that there is a difference between loving it and just being addicted to it, right?
Yeah, I thought I had it beat, Mary.
I know.
I really thought I had it beat.
You have just heard an actual phone call to a free and clear specialist from someone working hard to quit smoking. There are almost 50 million smokers still in the United States, and of these, 8.5 million are suffering from a serious chronic condition. Worst of all, 440,000 people a year are dying from their tobacco use. The good news? 3 out of 4 of them want to stop. Unfortunately, less than 1 out of 20 are successful if they quit on their own without assistance. The toll of tobacco use extends beyond the individual to health plans, employers, and other healthcare purchasers. We must work together to help individuals break their dependence and lower the cost to society.
Why should health plans cover smoking cessation? Well, they should do it because it should be a basic part of medical care. I mean, you're going to save more lives if you get people to stop smoking than anything else that you're going to do, mammograms or colonoscopies or flu vaccine. Also, patients who stop smoking are healthier. They're less likely to get heart attacks, to be in the coronary care unit. If you're an employer, you should be very motivated to have your employees who smoke quit. Why? They'll be absent less because they'll be less sick. They won't be taking breaks. They won't be getting secondhand smoke on their colleagues. Their health insurance should come down because they won't be hospitalized as often. And finally, it's the right thing to do.
The Free and Clear program was designed and evaluated as part of a National Cancer Institute-funded trial back in 1984. And that was the first trial to develop and test a proactive telephone quit line. The results were very positive, and Free and Clear has gone on to become a model for most of the country's proactive telephone quit lines. In addition, Free and Clear is based on the new science that's evolved since 1984 and has been incorporated into the program.
I've tried several times. It lasts for a couple days.
Okay.
And then pretty soon I'm just frustrated or at the end of my rope, and I'm thinking, okay, I'm probably not going to be as grouchy if I just take a couple drags of this cigarette, and then I'll take a couple drags, and then it just leads to another cigarette and
Yes.
another cigarette, and I never dreamed that I would ever be chained to cigarettes like this.
Yes.
Honestly, I never did. I thought, oh, well, I'll just smoke a few now, and then, but I can quit anytime. Everybody says that.
Yeah, they all do.
Until you go to quit, and you're like, there's no way.
Most patients want to quit. 70% of smokers want to quit, but most of them, it takes them 8, 9, 10 times. So it is really, really hard. And there's a different road to quitting for each patient. But for many of them, the telephone quit line is going to be an easy answer and a good answer and an answer that they're going to like. I've had patients who won't keep a return visit with me because they're so ashamed of themselves. When I give them the number to call for a quit line, they can do it on their own terms. And for some of them, this is the best way.
What was the most useful for you in this talk?
Just talking to somebody that understands what I'm going through. Really, it's a matter of breathing and not.
The greatest benefit of phone-based counseling is that it comes to you, or you can come to it. You don't have to go to a clinic. You don't have to get in your car and travel. It's available when you need it and when you want it. And what we've learned about telephone quit smoking counseling is that it's more appealing to smokers, and it reaches a more diverse population of smoking than we've ever been able to reach with clinic-based approaches.
What I'll do is just get a little bit of background, and then we can kind of work on a plan to get you closer to that goal of being a non-smoker.
Oh, that sounds so good.
Okay. So how many years have you been smoking?
Since I was 8.5.
Long time.
What a phone counselor does is to really take what we know about how quitters succeed, take what we know about effective techniques, evidence-based approaches, and translate them into a personal quitting plan for that quitter. Every quitter faces special barriers. Every quitter has unique reasons for quitting, motives for quitting, and really evolves this special, somewhat unique quitting plan. And that's what the counseling does. It really tailors to each individual. It's not one size fits all.
A lot of people have different goals with quitting. I'm wondering, where do you stand right now in terms of your readiness to quit on a scale from 1 to 10, with 10 being, I really want to give this up?
About 9. My doctor did some tests and results came back and got severe emphysema. I've been using this powder inhaler to open up my lungs.
Okay.
Helps me breathe a lot easier, but a couple of days ago I saw him and he told me if I don't really try this time around and try to quit, I might live about 6 months.
Okay.
That's how bad my lungs are right now.
Sounds like the doctor is incredibly concerned about your health, really worried about what will happen if you keep smoking.
Patients who use a telephone quit line like it. They like it because it's convenient, they like it because they do it on their own time, and they like it because there's some anonymity. They don't have to lose face telling their doctor or their nurse that they can't quit.
When I was working at Duke, it was so clear that what people needed to quit smoking was a coach, a guide. Somebody not only to point the way and provide techniques, but to bolster their confidence, to believe in them, and to help them sort out which of the available methods and approaches would work best for them. And that's what telephone counseling can do. And that's what a telephone counselor can do for a quitter.
The telephone quit line is one of the best kept secrets in public health. People like them, they work, they're convenient, and yet nobody knows about them.
Well, how are things going with your quit?
6.5 months.
Woohoo! That's great. That's so fabulous. I know this was really important to you. You said your motivation was really high in that last call when we talked in September. Are you feeling pretty much over it, or have you had any close calls?
No, but I have definitely quit. I was smoking 2.5 packs a day.
Wow. What a success to go from 2.5 packs to being quit for 6 months.
6.5.
6.5. We gotta get that half in there. If you were to give any kind of advice to somebody else that was quitting, what kinds of things would you encourage them to do to fight urges?
Well, I tell them to call you.